Hello, my name is Elizabeth Shuman. I'm a fourth-year otolaryngology resident at the University of California, San Francisco. I'd like to thank the Fall Voice Committee for allowing me the opportunity to tell you about one of our projects we've been working on here. And thank you all for your time and attention today. First, a big thank you to my team who helped with this project. First, Dr. Clark Rosen and Sarah Schneider, who've been invaluable mentors. Shahina Wan at Bloomsburg University, who was very helpful in the voice analysis and interpretation of our data. Cami Chan, who is a postdoc SLP at UCSF, and the entire UCSF Voice and Swallowing Center faculty and staff, who were very, very supportive. None of us have any pertinent financial disclosures to discuss. To start, even before COVID hit, we decided that there was a need for remote voice testing, especially in our clinic. We have a lot of patients who come from a distance for voice care, and we'd love to be able to improve access to them. And we would like to be able to monitor treatment therapies in response to treatment over a longer period of time. And also, on the other hand, use these data points in research to help learn about the dysphonia more. Then, of course, COVID hit, affecting us all. A lot of our treatment modalities have gone to the way of telehealth, and we were limited in our ability to perform analysis with a lot of our limitations in clinic just based on infectious disease protocols. Smartphones were sort of an obvious choice. They have been looked at in the past for their fidelity in being able to record voice reliably, in their ability to do voice analysis in some cases, and they're ubiquitous. Over 80% of adults in the US have a smartphone. Voicemail has also been used for a long time to monitor disease progression and treatment therapies related to Parkinson's-related dysphonia and spasmodic dysphonia. For us, the question was, can we do remote acoustic analysis over time in our clinic? And in this particular study, which was the first stepping stone, we wanted to see if this was feasible to record and analyze voice samples using smartphone and landline recordings. And we recruited healthy volunteers for this first step. A word about capsular peak prominence, which is likely a familiar topic to many in the audience today. We use this as our primary value for comparing samples because it really was a robust and sensitive acoustic measure of dysphonia. It's not time-based. We can use it for running speech, and it was sort of an easy way for us to compare all of our samples. To outline our methods, we started with 10 healthy volunteers. We brought them to the Voice and Swallowing Center, and we had them kind of connected to 3 different recording modalities simultaneously. And we had them record our standard sort of set of passages, the rainbow passage, Cape B sentences, etc. When needed, we performed lossless file conversions, and we put those files into CSL for analysis. And we came up with our data, the CPP in particular, but also low to high ratio, FNOT, and CSID. Here's our very high-tech setup. Here we have the Voice Lab microphone mounted on the headpiece. We have our handheld landline, which is connected to the UCSF voicemail service, and a smartphone here with a 10 centimeter measuring stick fashioned from a tongue depressor based on prior studies that have shown that that's the ideal distance from the smartphone microphone. To summarize our results, we ended up with 9 participants. We did exclude 1 outlier due to some perturbations in the sound files. We had 4 males and 5 females. The inclusion criteria simply being answering no to the screening question, do you currently have a voice problem? All CPP values were in a normal range in these participants. All of them, unsurprisingly, own a smartphone, and all of them have a normal VHI-10. I'll play you some examples. Here's the Voice Lab, which is our gold standard.
The rainbow is a division of white light into many beautiful colors. It takes the shape of a long, round arch with its path high above and its 2 ends apparently beyond the horizon.
And then here's a smartphone recording.
The rainbow is a division of white light into many beautiful colors. It takes the shape of a long, round arch with its path high above and its 2 ends apparently beyond the horizon.
And then here's the voicemail recording.
The rainbow is a division of white light into many beautiful colors. It takes the shape of a long, round arch with its path high above and its 2 ends apparently beyond the horizon.
So just by listening, you can hear the differences in some of those. A word about analysis. We not only performed traditional correlation analysis, but we also used the Blend-Altman plot. And this was a technique that we came up with our statisticians to compare this new measuring tool, comparing it to a gold standard. So it looks at agreement between results and not correlation. Correlation can describe a relationship between things like, for example, shoe size and shirt size might be correlated, but those things might not be interchangeable or measuring the same thing. So basically, if all of our data points, or if 95% or greater of the data points are within the dotted lines, which are 2 standard deviations away from the mean difference, that's felt to be statistically within agreement. Here's some of our examples of our results. Here's comparing smartphone versus voice lab with a sustained vowel. As you can see, all of our data points are within 2 standard deviations. And they also here on the right have a very strongly positive correlation with traditional correlation coefficient. So we found these to be statistically in agreement and correlated. Similarly, smartphone versus voice lab with a voiced sentence. Again, all of our data points statistically in agreement, and a not as strong, but still strongly correlated coefficient on the right. To contrast that, here we have a voicemail versus the voice lab with a voice sentence. We have one data point which is an outlier, which lies outside the 2 standard deviations, making that not statistically in agreement, and a weak correlation on the right-hand side. To summarize, all of our voice lab versus smartphones in these 3 different passages were statistically in agreement by Bland-Altman and also had a very strong correlation coefficient. Whereas when we compared the voice lab to voicemail, that was not the case. They did not share that relationship. Some of our discussion points, we did find that smartphones correlated with our gold standard. As these smartphones become more technologically advanced and the microphones get better and better, they do approach the fidelity of these in-person microphones. So we think this represents a reliable way to capture data that we can then use in analysis. It opens the door to a lot of different things. We can use this for research and for patient care. Voicemail recordings, on the other hand, were incongruent, and a lot of different reasons why that might be the case. Sound file compression, reduced sampling rate, frequency filtration, and not as reliable for voice testing by these measures. Limitations of this study. All of our volunteers were healthy, and this does not represent people who have dysphonia, and all of the recordings were done in the voice lab, which are not representative of real life. Next steps, we hope to recruit patients with dysphonia to see if we can replicate these results, maybe have subjects record at home, which is the more realistic way of doing this, and of course, implementation into clinical care, which we've already started to do. Thank you so much. I'm happy to answer any questions.